magnetic field therapy is extraordinarily important for peripheral neuropathy. There is more information in my book, Power Tools for Health, about peripheral neuropathy. There's also information on the website. Often you have to find out why the problem exists in the first place. You need to be treating the brain as well as peripherally. Magnetic field therapy is most effective for diabetic peripheral neuropathy. Other forms of peripheral neuropathy are harder to deal with because we don't always know the cause. It could be due to toxicities or viruses or combinations of these things, insecticides, pesticides, other types of toxicities. And it's not easy to get rid of the toxicities. So very often what you're doing then is just basically treating the inflammation. Most neuropathies do not get treated locally. So in the case of diabetic neuropathy, the solution is to get rid of the diabetes, is to reduce the A1C levels, hemoglobin A1C levels. But if you have tissue problems, if there's no circulation to the tissues, you got to improve that. If the neuropathy is coming from the back, from a problem with a disc, then you got to treat that. And for disc problems, you're normally going to need to use higher intensity magnetic fields. You can sometimes get away with a lower intensity system like a micropulse or a flex pulse, but I usually recommend a much higher intensity magnetic system. The one I typically recommend is the TeslaFit Plus 2, because it acts deep enough into the tissues to produce a strong enough magnetic field action to decrease inflammation, pressure on the nerve, to restore discs, to decrease the arthritic process in the spine. And so it can be effective, very, very helpful, and often very, very quickly. But you're going to have to continue to do this treatment for the rest of your life. So going to somebody for a chronic disc problem provides at the most temporary relief. Doing injections provides at the most temporary relief. And you can only do so many steroid injections anyway, and what they do is they weaken the ligaments and the tissues around the injection site. If you inject the skin with a steroid for people with bad acne, you'll get a pockmark, you get a little crater. What does that do? It's almost like melted the tissue. You inject that into joints, you inject that into the spine, what do? You weaken the ligaments and the tissues around it. Yes, you'll feel better fairly quickly, very often. But how many times you want to inject that tissue with a steroid? You're going to weaken those ligaments in that area. I don't think it's a good idea at all. But that's what doctors do because that's the tool they have.